Welcome back to Sleep Better TV, and we continue our discussion with Dr. Harvey Reiter. He practices dentistry in Las Cruces, New Mexico, and we're discussing the treatment options and the diagnosis of sleep apnea. Let's talk about diagnosis here, doctor. How does one get diagnosed for sleep apnea?
Like we talked about before, there's a lot of risk factors and exercise, weight, but the really only way you can tell is by actually going to a sleep lab and having a sleep test. The gold standard for as far as sleep tests are overnight sleep tests at the sleep lab. They're called polysomnograms, PSG for short. And now another thing that's coming on the market are home sleep tests. So home sleep testing is now being recognized also by the medical profession and the insurance companies.
Dr. Reiter, what's the difference between the two sleep testing options, going to a sleep lab or taking one home?
They're both effective, but there's really, I'd say there's no comparison. There's so much more data you get from the sleep test at the sleep lab itself that you really can't compare the two. But some people just can't make it to the sleep lab. They can't get an appointment. Physically, they're not able to go there. Some people get a little claustrophobia. They really can't handle being hooked up with all these leads to for the polysonogram. So it's done at home. And just from my experience, if the patient has some severe, what they call comorbidities, or like other conditions, health conditions, say like severe cardiovascular disease, the PSG should definitely be the one that's chosen.
Well, finally, I'm sure that the people that you treat after they've been successfully treated, the quality of life changes significantly. Can you talk about that?
Well, what I've noticed is the one thing that goes away for the most part is the snoring. Now, a lot of these people are not even aware they snore, and it doesn't bother them when they're snoring anyway because they're sort of sleeping, but the bed partner certainly knows it. I mean, I've had people whose bed partner had to sleep in another part of the house because it's a racket. It's really loud. So that's the first thing that I get reported back to me. And then the other thing is people will be able to, they feel more rested, more awake during the daytime, and more able to concentrate and feel more focused. So overall, they'll feel better.
All right, Dr. Reiter, thank you so much. My guest has been Dr. Harvey Reiter. He practices dentistry in Las Cruces, New Mexico. I'm Scott Drake, and you're watching Sleep Better TV.